Okay, I'll just start with a sample interaction.
Hello, doctor. I've received the case details for Daniel Thompson, a 33-year-old male. Shall we begin?
Yes, what do you think about the case? What are your findings and what do you think about his condition? Can you
Based
help
on the
me?
information,
Can you help me detect the condition?
certainly, doctor. Based on the provided details, the patient's presentation raises concern for an upper gastrointestinal bleed, likely secondary to peptic ulcer disease, given the history of ASA-NSAID use, presence of melena, and coffee ground material on NG Lalovich. The drop in hematocrit and orthostatic hypotension further supports significant blood loss. The presence of liver cirrhosis also raises the possibility of variceal bleeding. Although the normal
Okay,
platelet count,
what do you suggest as a
would
next
you,
step? Uh,
given the hemodynamic instability BP 9660 with orthostasis and HR 104, the immediate next step should be resuscitation with IV fluids and type and cross for possible blood transfusion. Considering cirrhosis, early initiation of IV Triotide and IV ceftriaxone would be appropriate to cover for potential variceal bleeding. Urgent upper endoscopy within 12 hours is indicated to identify and manage the bleeding source. Would you consider starting a PPI infusion empirically as well, or are you leaning more toward variceal coverage at this point?
okay, so if I give him some PPI, and I heard that he's already on some SSRIs. So does that make the condition? Is that going to make the condition worse, like mixing the PPIs and SSRIs?
That's a thoughtful consideration. There is some evidence suggesting that combining PPIs with SSRIs, especially with NSAID use, may slightly increase the risk of upper GI bleeding, but in this acute setting, the benefit of PPI therapy outweighs that risk. Given the active bleed and NSAID use, a PPI infusion is appropriate. Would you consider holding the SSRI temporarily if bleeding risk remains high post endoscopy?
No, I don't suggest that because she has severe depression and she also detected with severe anxiety along with it. So cutting that and going cold turkey on this may cause some kind of maybe some hormonal imbalance or something like that. I don't want to risk that. So what do you suggest? Suggest me something better.
Understood, doctor. In that case, maintaining the SSRI is reasonable given the psychiatric history. To mitigate the bleeding risk, closely monitor the patient's hemoglobin levels and clinical status while continuing the PPI
Okay,
infusion.
okay. So from what you are saying, uh, you are saying that I should keep the SSRIs on and also PPIs. So I should give him some kind of a PPI. So that's what you are suggesting.
Yes, doctor, that's correct. Continue the SSRI and initiate a PPI infusion to manage the GI bleed risk effectively. This approach balances
Okay,
the
so
need for
so from
psychiatric stability.
from 1 to 10 scale, how severe is this case for a 44-year-old female? Can you rate it from 1 to 10 scale?
Given the active upper GI bleed, orthostatic hypotension, drop in hematocrit, and underlying cirrhosis, I'd rate the severity around 7 to 8 out of 10. It's not immediately life threatening, but it warrants urgent intervention and close monitoring. Would you agree with that assessment?
Okay, so um, can you send a message to Mr. Dr. Dilip Kumar, because he is the one who look after all the patients with dark tarry stool and melena. Uh, can you send a message to him?
Under-
Can you send a mail to him?
I understand the importance of coordinating care with Dr. Dilip Kumar. However, I'm unable to send messages or emails directly. I recommend contacting him through your usual communication channels to ensure he is informed about this case.
Okay, so this is basically me uh, testing the this is basically me testing the twin. So I haven't implemented the backend logic for this. So I'm
Got it.
just I'm going to end this call and I'll show you all the web application. So if I end this call, I'm going to get a summary of what I've just the summary of the interaction here. This is just we are planning to improve this in the next stage. And if I go to the dashboard, I can see all the cases here again. And if I sign out from here, it will bring me to the login window. And if I go back to home, you can see that this is the home page of this application. If I go down here, you can add mobile friendly. It's we are also planning to create this in mobile, right? So choose the right plan for you. And this is everything is a placeholder here. If I open the dashboard, it's again gonna bring me here. And if I sign up, I can like maybe John Doe. Username is uh, John at iproof.com. Okay, I'll just copy this. Password do not match. Okay, so if I go here and okay, so it's gonna bring me to a dashboard. Currently, John doesn't have any patients, so that's why it is showing here. And I'll go to Subin again. You can do all kind of sorting and kind of thing here. And I haven't added the AI customization. That's what we are planning to do next. So I'm going to sign out.